Pancreaticoduodenectomy, or Whipple procedure. If you have been told that you need a Whipple, or pancreaticoduodenectomy, then it means you have a tumor or other disorder in the head of your pancreas, in your distal bile duct, or in the first portion of your small intestine that needs to be removed. To do a Whipple, we gain access into the abdomen by doing a laparotomy, which is an incision on your abdomen. Sometimes we can use a more minimally invasive approach. This is done through smaller incisions with a laparoscopic or robotic procedure. Once we get inside your abdomen, the operation is very similar. When you swallow food, it goes down your esophagus and into your stomach. It then passes through a muscle called the pylorus and enters your small intestine. The first portion of the small intestine is called the duodenum, and the second is called the jejunum. The pancreas sits here in this little loop of duodenum. Your liver and gallbladder sit here in your right upper quadrant under your ribs. They are connected to the pancreas and small intestine by the bile duct. This entire area here, at the pancreas, duodenum, and distal bile duct, is all connected. Because the blood supply is shared, you can't just take out the duodenum, distal bile duct, or pancreas head. They have to come out together. Again, this operation is being performed because you have a tumor in the head of your pancreas, your distal bile duct, or duodenum. In order to get access to the operative area, we must first divide your stomach either here, just before the pylorus in a classic Whipple, or, if we perform a pylorus-sparing Whipple, we divide just a little bit further down. Next, the bile duct is divided before it reaches the duodenum. We then divide the small intestine here, at the border between the duodenum and jejunum. Finally, the head of the pancreas is divided. We can now remove the tumor and surrounding tissue. So again, in this operation, we take out a small piece of your stomach, a portion of your bile duct, your gallbladder, the part of your pancreas containing the tumor, and your duodenum. We now have to make 1, 2, 3 new anastomoses or connections, which will allow you to eat and drink. In order to do that, we must perform a reconstruction. First, we will take this part of the intestine, which is called the jejunum, and we will bring it up here and sew it to the pancreas. This is the first connection. We will then make a new connection between your bile duct and intestines. That's the second connection. Finally, we will come down here and make a new connection between your stomach and small intestine. This reconstruction will allow the enzymes from your pancreas and liver to enter the intestines, as well as allow food and drink to pass through your stomach and into the intestines. So again, this is a pancreaticoduodenectomy, or Whipple procedure.